Welcome to For Your Head Media, Miriam, nurse practitioner. The topic we're talking about today involves only women, but if you're a man and you are watching it, you can go ahead, watch it, and then share with your loved ones. We are going to talk about cervical cancer. If you live in America, January is Cervical Cancer Awareness. Cervical cancer is a cancer that affects the opening of the womb or the opening of the uterus. What are some of the signs and symptoms of this cancer? Some women will complain about chronic pelvic pain, pain after sexual intercourse, irregular bleeding in between periods. Some of these symptoms also can be associated with other diseases, so the best thing is to get screening. One of the things that is known to cause cancer is Papillomavirus, the human papillomavirus. Another name for that is HPV. Now here in America, they have come out with a vaccine to start giving it to young people as early as the age of 11. And I put it with, I think, 26 to make sure that you don't end up with this cervical cancer. So if you have a child that is under, it's a young person, make sure you get them to get that vaccine. I know there has been a lot of controversy surrounding this vaccine because the human papilloma or the HPV virus is transmitted through sexual intercourse. So a lot of parents are hesitant to allow their children to get this vaccine. But mind you, the main thing for this vaccine is to also prevent your loved one from catching or getting the infection of the HPV, where they will end up with cervical cancer or cancers. So what are some of the treatments, or what are the diagnoses? Really, for cervical cancer, early detection equals early treatment, which is why there's a test that you might hear about, which is known as Pap Smear. They do Pap Smear. And the federal government here in the United States has recommended that women from the age of 21 and up should start testing, for cervical cancer, meaning you go and see the doctor and they do some testings, and send it in to detect cancer so that they detect it early. Because the earlier they detect it, the sooner, and the better your outcome as far as the treatment. So, like I said, January is Cervical Cancer Awareness. If you live in the United States and let's say you don't have insurance, because some insurance will cover it, 100%, meaning you see the doctor, they do the test, you don't have to pay anything. But if you don't have insurance, you could go ahead and call the 1-800-4-CANCER. 1-800-4-CANCER. And or better still, you can get on the internet and Google free cancer screening resources near me, because there are a lot of grants out there. Or you could also check with your head department. The head departments also offer free screening or sliding scale, for those that don't have insurance. So please get screened. Early detection equals to early treatment equals to better outcome. So go take care of yourself. See you in another video. Short and sweet.